Good afternoon. My name is Allison Okonski. I'm an LPN. I have been for the past 20 years, and I'm here today to talk to you about the subject of nursing burnout. I have passed out some PowerPoint slides for you to review and to follow along. If you have any questions, you can hold those to the end, and I'll try to answer them as best as I can. Nursing burnout, what is it? When doing some research on it, I found a study done in 2012 by the UCLA Medical Department. They stated that they felt that nursing burnout was the collapse of the human spirit. Now, the collapse of the human spirit, that's kind of broad. What does that mean? It's an emotional collapse of a person. You're drained, emotionless, detached. As you can tell, being a nurse, you're supposed to be caring, loving, compassionate. Obviously, that's going to be a problem if you have nursing burnout, because you're not going to have all those traits that you're supposed to have to be a caregiver. So what causes nursing burnout? Why are nurses at such high risk to have this happen to them? Nurses work on a day-to-day basis in stressful situations. They have death, dying, births, surgeries, all kinds of things. All of it is stress compounded on stress compounded on stress. Staffing is usually low. Communication is a big part of that. Communication is essential for any type of position that you have, any job, nursing, or any other kind. If there's not communication or a breakdown in communication, people don't feel a part of the group. They don't feel included. They don't feel informed. So that leads to nursing burnout. Also, in the study by UCLA, they mentioned depersonalization. Depersonalization is a biggie because when bad things happen, such as somebody's dying, maybe you're in the ICU, there's a lot of death and not a lot of happiness going around, you kind of close yourself off from that. It's not Mr. Jones or Mrs. Smith, it's room 10 and room 12. The fear of dying, the fear of failure, the fear of error on the part of the nurse all can lead to that depersonalization. Hours are another big thing that leads to this issue. 8-hour shifts was always the common thing. Most professions, you know, you work 9 to 5, you work 7 to 3. In the nursing profession, 12-hour shifts are getting to be a big standard. Nurses really like those shifts, per an article I found done by Penn State Nursing. That's a big thing for the nurses. They have more time at home. They work less. They work maybe 3 days a week instead of the normal 5. But in that study, it shows that anything over 8 hours leads to nursing burnout, whether the nurse thinks it's a good choice for her or not. Turnover is another biggie. Last year, 60 to 75% was the normal turnover rate yearly in a place. Just imagine, you know, you get a new employees in, 60 to 75% of those are gone by the end of the year. That's bringing in new people, having to train new people, getting to know your ways, getting to know the patients, the doctors, the other nurses, the other staff. And that's a big thing. Another thing is emotional exhaustion, which kind of goes back to where they stated in that article what burnout is. Emotional exhaustion, you're taking on people's problems, you're taking on their emotions, you're trying to be the strong one, trying to be there, do everything for them, and you just are spent. You don't have anything left. You don't have anything left for yourself, for a patient, for anybody. That's where they say you need to take care of yourself or you can't take care of anyone else. That's where that emotional exhaustion would be a good example. All of these things lead to higher stress levels, depression, anxiety, isolation. All of those things are all big issues and causes of burnout. Other things that we can talk about is lack of job satisfaction. If you don't like your job, you're not going to be satisfied, whether it's the hours, the pay, anything like that, the people you work with. Also, the statistics listed in the article from UCLA that I mentioned before, that's a big thing. They noted that females with a family, with children, they're more likely to stay at their position. They're more likely to not have a turnover rate. The younger generation that's coming in, they get stressed out, they get depressed, those sorts of things. They don't have anything to tie them down, they leave easier. So they're kind of the revolving door effect. Like I said before about the turnover rate, the U.S. government and the Nursing Statistic Board states that by the year 2020, there's going to be about 1 million nursing jobs available. There's going to be that many open vacancies between people that retire and people not renewing their license anymore. From the Nursing Bureau, the Statistic Board, they stated that they polled a group of nurses. This group of nurses stated that 83% of them said that that's a big issue for them. 93% of them said that those open positions and the lack of nursing staff and the turnover will definitely affect them leaving their position when it becomes too bad for them. So, all these problems, all these things that causes burnout, how does it affect anybody else besides the nurse that it affects? Does it affect anybody else? Yes? Yes, it does. Does it affect you? Does it affect you? Does it affect your mom? Your dad? Yes. You have a nurse, comes out, takes care of your loved one. If they're burnt out, how are they going to take care of that family member or you? Not very well. They're not going to be personable. They're not going to be caring. They're not going to give you the extra attention. So patient care is going to suffer. The mental health of the nurse is going to decrease. They're not going to be able to take care of themselves, let alone take care of somebody else. The isolation, the anxiety, the stress, the depression that might come along to that nurse, that's going to affect their family at home, their home life. That's going to deteriorate, make them more burnt out, make them less effective at work. So how are we going to limit burnout? How do they do it? During my research, greater communication, that's a big thing. They need to be included, they need to feel part of the group, they need to have those relationships with the patient, with the doctor. That will increase the patient care. Therapy sessions for staff. I also saw therapy sessions that were being offered weekly for staff. That improved the morale, that improved the mental health of the nurses, which then turned around, decreased the turnover rate and increased the way people took care of the patients. Positive coping skills, that was another big thing. A lot of these nurses don't utilize positive coping skills. They go out, they hold in their feelings, they don't talk about things, they go out, they smoke, maybe some of them drink. When I looked on the nursing website, PA Department of Health, they have a nursing bulletin that goes out every month. It'll let you know all of the nurses that were convicted on drug-related charges or alcohol charges, which is astonishing if you go and take a look at that. So we talked about what burnout was, what things can cause it, what things can help it, and how it affects everybody. Anybody have any questions about any of that information? Yes?
Is burnout in other professions the same as it is in a nurse's profession?
You can have burnout in any profession. It could be nursing, it could be anywhere. Truck drivers, stressful job. They're on the road. They're always driving, lack of sleep. They're going to be stressed out and burnt out. Low wages. It's going to happen there. It can happen anywhere, not just the medical profession. Anything else? Yes?
Can it happen at a job like if you're a teacher?
Yep. It could happen if you're a job with a teacher. Because what do the teachers have that's stressful? What do you think?
Teaching kids.
Kids. Lots of kids. So, if the kids are being unruly and they're not raising their hands and they're hey, 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 is that going to make the teacher a little stressed out?
It's going to make her a lot stressed out.
Okay. So, yep, it can happen there too. And there's a lot of kids and only one teacher, right?
Mhm.
That's a lot for a teacher to handle. If she has 40 kids, just like a nurse, she might have 60 patients and it's only her or him. I'm sorry, I'm referring to nurse as her, but it can be him too. Yes?
You talk about nurse burnout and the turnover in nursing. You said that women with children tend to stay with their jobs, and the younger women tend to leave. Is it a change of times that are making them leave, a lack of responsibility that's making them leave, or is it the burnout?
Well, all the surveys that I saw and all the studies, even some that I didn't use for this particular speech that I'm having, it's a number of things. The people in the survey done by UCLA that I was talking about, when they discussed the older woman nurse with children and a family staying at their job longer, a more stable job, they have other things that they have to tend to. They have a mortgage, they have a car, they have this, so they tend to be more fixed to their job. They have a lot more to lose if they leave their job, so they might be willing to put up with a little more.
So more responsibility.
Right. They have more responsibility home-wise than
More
maybe somebody.
responsibility helps decrease burnout?
It doesn't help decrease burnout, it might help them stay a little longer.
Okay.
So they might be a little more apt to put up with it or truck on a little more. You know, maybe they'll go and seek out the therapy. Maybe they'll go out and go to the doctors and, you know, see a doctor for some of these underlying things like stress and depression and things like that. They might be more apt to do that than the younger person coming out of school. Might get a job and say, forget this is stressful, I can't take it, I'll try a different job. And then I'll try a different job. So that might be where they're coming from that. Anything else?
This is another worker. How could a firefighter get stressed out if they don't go to like a bunch of fires at once? They only go to one.
Okay. All right. Now, firemen, that's another stressful job, right?
Mhm.
They don't have it's not always a lot of firemen. It's a big building that's on fire maybe, right? There's people in there, animals in there. How are they going to get them all out?
There's lots of personalities to work with.
You know. So, yeah, I mean, maybe the communication's not good. You know, maybe you got the big boss over here, just like you do at other jobs, nursing jobs. Maybe the big boss just kind of barks orders around and doesn't really communicate what's supposed to be going on. You know, so you have people going here, there, and they're kind of disorganized. So maybe that can contribute to that. But that's a good question. Fireman job is a very stressful job. You know, I think it takes a special kind of personality and person to do that particular kind of job too. Anything else? No? Okay. I'm going to turn the camera around a minute so that I can show my audience here. Tyler, David, and Bryce. Thank you for coming and listening to my speech, guys. I hope you learned something about it, and thanks.
You're welcome.